So good morning, everybody, and welcome to Dr. Dielle Raymond. Dielle is back to talk about eye care. That's something I don't think we talked about yet, eh, Dielle?
I don't think so.
So looking forward to this from a naturopathic perspective, what this is going to look like. So that's a play on words. What it's going to look like.
We got it.
Connie, you're supposed to be muted.
Oh, sorry.
Glad I made you laugh, and I'm going to mute myself. Whenever you're ready, Dielle.
Oh, okay. Sorry. I am just going to be honest with you guys and let you know that I just dropped my husband off at the ER. He just has a concussion. He's going to be okay, but I am probably a little scattered. So bear with me if at any point you're like, what is happening right now? Eye care is an interesting thing for me because I have eye concerns. And so in some ways I am, it's something I have a very special interest in and a ton of knowledge in. And then in other areas, I have found myself reviewing my notes from classes I've taken and lectures. So I've tried to put together the information I thought you guys would find the most interesting. And as always, please interrupt at any point if you have any questions, okay? So I am going to, I think I figured out how to share my screen. Well,
That's good, Dielle. Thank you.
Okay, so to start out, we have a diagram of the eye, which is really an important place to start because it's a tricky place. I remember when I was taking anatomy, memorizing all the different parts of the eye was one of the most complicated things. So in the eye, the cornea is the part that protects the pupil and the lens, but the water and the liquid in the cornea also does the beginning of the job of changing the trajectory of the rays of light so that it's something your brain can properly process. The pupil and the iris are primarily involved in opening or closing the opening of the eye in order to let in a certain amount of light and again potentially change the angle of the rays a little bit. The lens is the thing that primarily does that focusing of the lights, the lights. The vitreous humor is the liquid. It's a gel-like liquid in the inside of the eye. And it is primarily there to just maintain the pressure and the structure of the eye, but it also has a little bit of effect on the rays of light. The sclera is the lining of the part of the eye that isn't letting light in. And then the retina is where we start to process the information of the light. The macula is where we process the stuff that's right in front of us. And the fovea is the very center of doing that. So if at any point anybody wants me to return to this diagram, just say the word. So to start out with, one of the interesting things about the eyes is that they are one of the most fragile parts of our body in terms of being susceptible to the damage of the world. So some of our most fragile parts of our bodies that are susceptible to the damage of the world are our brain, our, maybe not our, but testicles, ovaries, and the eyes. Those are the main areas. And so a lot of what is going to keep the eyes happy are the things that are going to keep the body happy. And so that'll be some of what I'm going to talk about today is going to be sort of like, okay, we're talking about the same things. But that is because one of the primary things to do for the eyes is to keep the circumstances the body operates in really in a very healthy place so that the eyes are very healthy too. Interestingly, in terms of the eyes being fragile, they're actually quite resistant to all sorts of physical insults. So you can do a lot to an eyeball before it's going to stop working. So when I say fragile, I just sort of want to make sure that I don't give that impression that it's, you know, they're we have to be extremely careful to protect them, though it is nice to protect them. So cataracts are when the lens, so I'll go back for a second. So the lens, you've got the cornea and the pupil, and then the lens. The lens is the part that changes shape to change how the rays of light are coming in the eye. So it's when the lens begins to break down and causes the vision to become hazy or cloudy. We have lots of theories about what contributes to the formation of cataracts because they do form faster in some people than in other people. But the only thing we know for sure that causes cataracts is age. So that lens, due to the damage of the world over a certain amount of time, starts to break down in a way that is going to block that vision a little bit. So the smart things to do, and I've phrased this specifically as the smart things because this is what a lot of people recommend. And we have very strong theories that these contribute, but we don't have proof that these contribute. Control blood sugar. So for sure, our eyes are very sensitive to difficulty keeping blood sugar balanced. When the blood sugar goes up and down too much and it's too high, that negatively affects the eyes. We know UV light is hard on the eyes, and we know that for people who have light colored eyes, they are more susceptible to some of these things that can go wrong with the eyes because that's letting in more of the UV light, which causes damage. We know for sure that smoking is particularly hard on your eyes. That is a proven connection in terms of eye health. And then managing weight and keeping alcohol consumption under control is super smart. And then eating a lot of fruits and vegetables is helpful, particularly for giving you nutrients that are protective for the eyes. I'm going to give you more specific recommendations for things to use, but I always encourage you, I need to be careful to not have this be a circumstance where I'm just sort of like, you know, prescribing for everybody. So I would please encourage you to not just sort of take this list and, you know, the thing I fear the most is somebody just sort of going and buying all those things and not, you know, having it be safe or get along with their prescriptions or whatever it might be. However, I'm going to go ahead and do it. So L-carnosine eye drops are one of the things that has some like just starting to get into evidence for helping with cataracts. And that's basically because the suspected mechanism of action is that they have a strong antioxidant effect and they're close enough to the lens to have an effect. So an antioxidant is something that helps to reverse that damage of the world. So if the eyes are more susceptible to the damage, an antioxidant makes it more hardy to that. Okay, please, for anybody who has a question, interrupt at any point. But we're going to talk about the next one, which is needing reading glasses. So there are two main causes for when most of us start to need reading glasses. The first is the weakening of the muscles in the eye that change the shape of the lens. Because I have a diagram I'll show you in a second. The second is a hardening of the lens. And these are kind of the same thing, because if the muscles aren't strong enough to change the shape of the lens, you can't see stuff up close. But if the lens is harder and the muscles aren't able to change the shape of the lens, same result. This one is also most commonly associated with aging. Symptoms are considered normal after 40 years of age. And so I've got a couple diagrams here to show you what's happening. So you've got the lens that's either allowed to bulge or it's pulled thin. And there are ligaments and muscles on either side of the lens that do that. And so the primary muscle we're talking about here is the ciliary muscle. And so it's a weird thing to wrap your mind around, but the ciliary muscle actually contracts and then the lens bulges to give you close focus. And so I think that the main way you can think about this is that the bulging is actually not the natural state of the lens, but I did spend quite some time yesterday looking at this and trying to wrap my mind around why the muscle is contracting and then the lens is bulging. But if anything interferes with this process, primarily the lens being rigid and not being able to move so easily, then you need the reading glasses to be able to change the line the light is following so that you can actually read the words. Okay, dry eyes. Dry eyes, I almost would be interested in conducting a poll to see how many people who are listening today have dry eyes, but I would imagine it's a good portion. So the main cause of dry eyes is, and so I'm putting speculated next to estrogen excess and deficiency because we haven't proven a connection yet, but we do see that in the changes of perimenopause and menopause, dry eyes can tend to have a spike in symptoms and then a decrease in symptoms. Generally, you have layers of liquid on top of your eyes. So you have what's referred to as a mucin layer closest to your eye. A lot of the sensitive tissues of your body are covered by a mucin layer, which is kind of a fancy word for mucus, but it's not gross, it's that layer. And then you have tears, and then you have oil. And so that can be part of the reason that if you have dry eyes and you pour artificial tears into your eyes, it only lasts for a little while, because if you don't have that oil layer to hold those tears in, then the effect doesn't last. And that can be why eye drops get thicker and thicker to try to replicate that effect of the oil. We don't have a mechanism by which you can use drops that give you the same as tears and then use drops that give you the same as oil. So another cause of dry eyes is prolonged work that doesn't lead to sufficient blinking, which is a bigger deal than you might think. So on average, we blink 22 times a minute. While we're reading, we blink 10 times a minute. When we're looking at a screen, we blink 7 times per minute. And this ties into inflammation. Inflammation can be a huge part of dry eyes, because when the eye is not having enough tears, then it gets inflamed, and there's a process by which that inflammation interferes with the process of producing the lubricants that make things more comfortable. And that's I think that's underemphasized, that inflammatory part of dry eyes. And then the last one is Sjogren's syndrome. Sjogren's is an autoimmune condition in which the immune system attacks the glands that lubricate the eyes. And it is an interesting thing because it's not without value to determine whether or not you have autoimmune disease, but unless your presentation is very severe, getting a diagnosis for Sjogren's when you have dry eyes doesn't change the treatment all that much. You're still looking at keeping the eyes lubricated and protected. So treatments for dry eyes, definitely fatty acids. So that's most frequently a fish oil combination, and it's well received and evidence-based enough at this point that I see most optometrists and ophthalmologists recommending particular products. And I see some of my favorite brands starting to release dry eye specific formulas. I know NutriC has. So there's evidence for it. And in terms of what I see clinically, it seems that people either respond to this beautifully or it doesn't seem to do anything at all. So and that doesn't mean it's not doing anything, but they don't notice anything. But for some people, it's a game changer. They notice a huge benefit, and they notice if they slack off on taking their fish oils, then the dry eyes come back. There's a good link with digestive tract problems, IBS and IBD. And so probiotics can be quite helpful to balance that out. And that is most likely the inflammatory mechanism of action. Vitamin A and vitamin D are closely linked to eye health. Vitamin C is a potent antioxidant and helps to decrease inflammation. Blocking blue light. So I'll sort of touch on that for a second. There's a lot of good initial evidence that blue light is harmful to our eyes. And I think I've talked to all of you before, but I always like to make sure that we establish blue light means light that is like the light coming from the sun. That's what it means. And that's why people are worried about looking at phones and tablets and computers a lot, and particularly after the time of day when our bodies are designed to look at the sun. And that can cause a lot of difficulties. It can cause difficulties with your natural rhythms for when you're exposed to sunlight and when you're not. And it can actually cause damage. The UV light of the sun, the blue light, can cause damage. And so at this point, blue light blocking glasses, I think, have become the norm.
Okay. DL,
Yeah,
I want to ask a couple of questions here.
please.
So I have one right eye that waters a lot, you know, does that mean it's a dry eye or?
So that's, so there's two things that happen. The watering is most likely involved with either the lacrimal gland, which is the one that produces the tears, or the duct that takes the tears out of the eye. Because those are the two things that determine how many tears you have in your eyes at any given time. So one of the treatments for a lack of tears is to actually intentionally block the duct that takes the tears out of the eye, so that you have more tears in there at any given time, which it's sort of, each person has their own idea of whether that's helpful or more annoying, right? Is it more annoying to have a dry eye, or is it more annoying to have a continually watering eye? I wouldn't be able to speak to which of those is happening for you. And it is possible that it is, sometimes I read words and don't know how to say them, compensatory. So it could be that your eye has sort of realized that it was too dry, and now it's just a little too aggressive about producing the tears.
It's
At the
usually
end
outside, it's usually outdoors.
That's interesting. So I would say that that's probably your body taking care of itself, and it just is doing it a little bit too aggressively.
Mm-hmm.
And that could indicate there's some inflammation in that eye, right? That your body's aware of the fact that it's a little bit more inflamed and wants to do everything it can to keep it in balance. But I'm speculating there. It would be interesting to see if that duct is draining.
And the other thing I wanted to ask about was the blue light. So I'm just getting a new prescription, and so I got that coating and whatever they put on there because I'm on the computer a lot now. And my prescription really changed over 2 years, or actually over a year, quite a bit, which was surprising. But I thought, I was thinking, I wonder if that's because I'm on the computer so much, you know, I don't know.
And
But,
that's,
you know, wear and tear kind of thing.
That's an interesting thing. So I personally, just in the last couple of years, had the experience of coming to work and putting on my glasses and being like, that doesn't seem quite right. And then it just got worse. And one day I came to work and I put on my glasses and I was like, nope, it is better without my glasses than having them on. And so I went to the optometrist, assuming that I had lost visual acuity. And instead my vision had improved.
Oh.
Yeah. So the circumstances in which your vision improve is at this point, or gets worse, generally is not scientifically based. We do not have scientific studies that tell us anything that actually improves vision. But we have a lot of anecdotal evidence that, you know, just from people who have done particular exercises or noticed circumstances in their lives that either improved or worsened their vision. I was going to say something else about that. The evidence is, so they've done studies where they take people, they put glasses on, then they test their vision, and then they test their vision later on, and the glasses don't worsen your vision. The understanding is that you have the perception of the glasses worsening your vision because you got used to seeing things properly. And then when you take them off, it looks to you like your vision is worse than it used to be, but it's just that you got used to seeing things clearly. I leave a lot of opening for something outside of the evidence in terms of exercises potentially helping. And I'll just tell you, I think I've got a slide on it later now, but I'll tell you now what I think the most important exercise is. And so the mnemonic for this is 20-20-20. And so the idea is that every 20 minutes, you look at something that's 20 feet away for 20 seconds. Because the thing we are doing, which is unnatural, is to look at something up close all of the time, particularly, I would say, during the pandemic.
Wow.
So, you know, the more prolonged focusing on something that's right in front of us, the more possibility that we're going to compromise our ability to look far away, even if those muscles weaken. And so the two things to do in terms of exercises, like if you're going to walk away from this conversation and do two things, the first one is to do a prolonged blink on a regular basis, because we don't blink enough. So when I say prolonged, what I mean is take a moment and scrunch your eyes together and hold them together. That can sometimes encourage some secretion of the oils, and then relax and just keep your eyes closed for quite a few seconds. And that's going to give your body a chance to actually properly lubricate and then open your eyes. And the other is to stop on a regular basis and look far away. There's a development on that exercise to choose something that's as far away from you as possible in the environment you're in, and something that's as close as looking at your thumb in front of you, and switch the focus back and forth. So focus on your thumb, focus on the thing far away, focus on your thumb, focus on the thing far away. But 20-20-20 is the way to remember it. Every 20 minutes, look at something 20 feet away for 20 seconds.
Okay.
Really, at the end of the day, it's just like kind of what I was talking about. It goes back to how it relates to your whole body in terms of we're not actually supposed to be just sitting and staring at something for long periods of time. We should be getting up and taking breaks and looking far away and changing our focus or not focusing on something. But these are specific ways to do it.
That's actually a Blue Zone community recommendation for exercise every 20 minutes. Get up, move around, you know, not sitting too long. And yeah, 20, you know, if you're working, if you're sitting, get up and after 20 minutes and move around, move your legs, you know, do something, go for a walk, whatever. And yeah,
That's neat that the timing matches up.
it does. It is. Yeah.
Yeah. I am happy to answer a question.
So my first question is, there's some, the name's gone from my head. There's an eye pill that they say take it. Is that just a bunch of vitamins put together in a pill? Do we need that if we're eating properly? That's one question.
I'm going to talk about that.
Okay. And one more question. What about polarized sunglasses as compared to just sunglasses? Is there a real difference?
I don't have a ton of information in regards to polarized. So right off the top of the bat, I would say that your most important thing, and that's a nice reminder to cover the fact that it is absolutely vital to purchase sunglasses that cover your eyes and they have UV protection on them. Because if they don't cover your eyes, and I don't necessarily mean they need to be gigantic wraparound, but they should be decent size and close to your face. Because if they encourage you to keep your pupils more open, to let more light in, because they are giving you the impression that it's darker, but UV light is still getting in all around the edges, then you're kind of shooting yourself in the foot. Or if you purchase sunglasses just based on style that don't have the UV protection, that's worse, because then it is convincing your eye that it doesn't need to worry about UV and then actually letting it in. So my only concern with the polarization, I know I love the fact that they help me to see much better into water. And so my only concern would be that that's encouraging me to artificially keep my pupils open more than I would, but I doubt that's a factor. So mostly I'm just saying I don't know about the polarization. That's an interesting question. And then the formula, I've got a couple slides on it. I assume you're referring to the Vitalux kind of eye. Yeah, cool. Okay. Is that okay for now for an answer? And I don't know, I guess that's not a great answer, but there you go. Okay, the last thing to talk about, oh, twice a day warm compresses. And so that's geared towards encouraging the glands to kind of relax and secrete things. I'm apprehensive about it because I worry about the compresses being too warm and causing inflammation. And I'm always much bigger fan of fixing things from the inside as opposed to trying to fix things from the outside. And ensuring that you're using preservative-free eye drops and or trying castor oil drops. I would strongly recommend that you not try castor oil drops on your own. There's a couple of factors you want to look for there, but it is a possibility. And one of the concerns with the preservatives is that they can be inflammatory for a lot of people. Okay, I looked for, I had a big debate when I was putting this together. I was like, do I have a picture of this that's as horrible as it could be? Do I have a picture at all? I decided on the middle ground. So this is the middle ground picture of Demodex. I would also be fascinated to hear how many of you have heard of Demodex, but I'll just go forward. So it is quite normal for us to have, like, we are more other things than ourselves. We have bacteria and mites and all sorts of things. The Demodex is a mite that lives on most of our eyelashes. It lives elsewhere, but particularly on the eyelashes. So to me, coming into this conversation, I just thought everybody had them, but it actually is the case that we tend to be more likely to have them as we age. It's a little known fact, but things like mites and scabies and things that live on us, we still use our immune system to keep them under control. And so your immune system status is part of whether or not they get out of control, or why, you know, two different people could be exposed to scabies and one person has a very different reaction than the other. And so they live on the eyelashes, and in some people they can get out of control or cause symptoms. And so the most common symptom that they can cause is blepharitis. Blepharitis is an inflammation of the eyelids, essentially, often in the eyelash area. And it's very uncomfortable for people who deal with it regularly. And so this is one of the neat areas where literally the only thing with good solid evidence for helping to control the Demodex is tea tree oil. And I thought that was really cool. Do not, under any circumstances, try to put together your own tea tree oil formulation and put it on your eyelids. that like keeps me up at night. But you can find commercially prepared and, you know, reputable products that have tea tree oil in a wipe that you can use. So if you want to, you can go and Google Demodex later on and look at what they look like in more detail, or you can try to put out of your mind the image I just showed you. But I thought that was quite interesting. Now, all cases of blepharitis aren't Demodex, but it's a significant contributor. Okay. Floaters. I don't think I've ever had the urge to conduct a poll as many times as I have in this conversation about who has floaters. Hang on. So floaters are when you are looking out at the world and you see things floating in front of your vision. The characteristic factor of a floater is when you can't look at it. You can't, it doesn't stay in place. So you try to look at it and it floats away. It is things generally floating in that vitreous body, but it can also be from a detachment of the vitreous body. So I think most of us have heard of vitreous detachment because it is a thing that is not uncommon for people to suffer from at some point as they age. And so that will look like the people who all of a sudden have a bright flash, all of a sudden have something in their field of vision, and they'll go and see the optometrist or the ophthalmologist, and they'll be diagnosed with vitreous detachment. and will be told the emotionally confusing news that eventually the thing that they see in their vision will probably go away, which is, I've been through this with people. It's very, very troubling when you have something right in your vision and you're not sure it's going to go away. So the detachment of the vitreous is when that gel-like sac in the middle of your eye detaches a little bit from the outside, and your body has the capacity to recover from that most of the time. So in terms of what contributes to the floaters, there are a number of different theories. For some people, it can actually be an issue with the veins that were there when they were in utero, not moving on as quickly as possible. There is a theory that it is an accumulation of proteins in the vitreous body, so they kind of clump together and give you symptoms. There is the theory that it is toxins, so that if your body is not detoxifying things properly, then things can build up in the eye. One of the issues with the eye is that it needs to keep itself separate from the body. And part of the reason is so that the immune system, if it gets aggravated elsewhere in your body, isn't necessarily going to get aggravated in the eye. So in conventional medicine, if floaters are just absolutely terrible, they will sometimes try to drain the vitreous body, but that is not commonly done and isn't a great solution. Anecdotally, people will report floaters getting better, and we certainly have the capacity to support the health of the eye and see what happens with that. But they're not a great thing to give solid answers on. In traditional Chinese medicine, they're very closely related to the liver, and sometimes treating the liver can help. But on the forefront, the most important thing to say is that they are normal. So it's not uncommon for people to, go out on the lake, where it's just like white, and then start to see floaters and not have realized that they had them before and think something's wrong. They're not ideal, but they are relatively normal. So just to kind of like wrap that up, the best thing you can do to deal with floaters is to support your overall eye health. So macular degeneration is when the macula, so you've got the retina, and then you've got the macula as the part that's responsible for seeing the stuff that's right in front of you. And so there's a degeneration of that macula, and that can lead to vision loss. And so the most important thing that I want to convey is that this is a nutritionally responsive condition. So it's a direct reflection of how you take care of yourself. So when we are doing physical exams of patients, looking at the retina is a really great representation of overall health. So looking at the retina is a great way to see whether or not someone has diabetes or is heading in the realm of diabetes, because those blood sugar changes show up very specifically on the retina. And some of the things that can cause issues with the retina is when your diet is an imbalance and you've got too much of the not ideal fats floating around. So I wanted to touch on the AREDS formula. So the AREDS formula we most commonly know as Vitalux. And then different companies will have different ways of doing it, but Vitalux is the most famous one. So the AREDS formula comes from the age-related eye disease study. And so the formula I have here is from the second iteration of that study. But in the study, they took people and gave them this combination of ingredients and looked to see whether or not they had age-related macular degeneration sorry, I'm phrasing it the wrong way, whether or not they got to advanced age-related macular degeneration in the course of the study time. So they showed that this formula helped. I'll just see what the next one is. Okay, they showed this formula helped, but the difficulty is that now in conventional medicine, they are just locked into this formula. They're like, this study showed it helped, so we're going to give everybody this exact list of nutrients, end of story. Until somebody coughs up the money to run giant trials on different combinations of this formula, conventional medicine isn't really changing it, but there are difficulties with this formula. So to start out with, they changed the formula between the first iteration and the second iteration to try to deal with some of these issues. So one thing they did is they replaced beta carotene with lutein and zeaxanthin. So beta carotene is the form of vitamin A that we get from fruits and vegetables. So, you know, you eat carrots for your eyes, carrots have that orange pigment, that's the beta carotene. And our body can take that beta carotene and turn it into the active form of vitamin A, retinol, which then beneficially affects the tissues. So there are two issues with beta carotene. The first is there are concerns with combining it with smoking. There are concerns that that can actually lead to an increased risk of cancer. The second is not everybody can turn beta carotene into retinol. So I am actually one of the people who has difficulty doing that. And looking at my genetic code and seeing that I had some genetic polymorphisms that interfere with my ability to convert beta carotene to retinol was great information for me to start to supplement with the active form, the retinol. So they took the beta carotene out and they replaced it with lutein and zeaxanthin. So they were looking to get that same antioxidant effect with something that wouldn't have as many health concerns. And so they found that when the participants took the formula containing the lutein and the zeaxanthin, the antioxidants, and no beta carotene, their risk was reduced by 18% more. Among the patients who had the lowest intake of lutein and zeaxanthin, the antioxidants, that's basically people who weren't eating fruits and vegetables, the risk was reduced even more. So switching from beta carotene to antioxidants helped even more. And in the people who didn't eat any fruits and vegetables, the effect was even more pronounced. So I'm going to tell you what my issues are with this formula. I love the lutein and the zeaxanthin. As a rule, the number for the amount of lutein you want to have is 6 milligrams. And as a rule, most people are getting 2 milligrams in their diet. If you're eating lots of fruits and vegetables, you have a much better chance of having the adequate amount of lutein. I do not love the quantity of zinc in this formula. This to me is a dangerous amount of zinc long-term. Zinc and copper need to be in balance, and it needs to be lots of zinc and a little bit of copper. And so when they put together this formula, they were aware of that, and that's why there's a little copper in there. But I don't love people taking 80 milligrams of zinc long-term. The vitamin E in the formula is not the ideal form of vitamin E. And those are my concerns. So ironically, I was reading through some of the summaries from the research, and they actually did arms of the study where patients took less zinc and they had the same benefits, but they didn't turn that into changing the formula. I don't know. Like, they had the wisdom to know that they should see if they could get away with less zinc, and they did, but it didn't turn into lowering the formula. So to give you a reference range, outside of a short-term support to the immune system, my upper limit for zinc is 30 milligrams a day. So it's better to take it than not do anything. And so for lots of people, you know, an eye-specific formula that has lots of evidence behind it is great. And I don't disagree. So I want to kind of give you like the way to interpret the information. If I have a patient whose medical doctor has recommended Vitalux and they're taking it and they feel good about it because there's evidence behind it, that is way more valuable than my concern about a little bit too much zinc. But I also want to tell you the information about the formula. Any questions about that? Okay.
So I have a question, please, Dielle. So would you be able to just take that formula like in individual bottles and play with the amounts?
Yes, absolutely. And that's sort of where that's what I'm talking about in terms of, that also gets into a compliance issue, right? So compliance sounds like somebody's like following the rules, but it's a word we use for whether or not people will actually be inspired to take their supplements. So you have one capsule that has a whole bunch of great stuff in it, or you have like 3 or 4 different things you have to take to replicate that effect, it may be that people are just more inclined to take that one capsule, and it's a win, right? It's more of a win to give all those things in a reasonable capsule and have that small risk of too much zinc causing issues.
Dorothy,
I have
yes,
a question. I have a question. And oh, sorry, Harriet.
go ahead. Go
I
ahead,
had it.
Dorothy.
I had it in chat, but
Oh.
I guess it didn't show up. I don't know. But I just wondered if different companies have the same formula that you just showed, because
Yes.
I've been buying for my husband Shoppers brand, which is considerably cheaper than Vitalux, and it has the same. I just looked for the lutein, but I didn't think about all the other things.
Yes. So the other one that I know of right off the top of my head, that's the AREDS formula, is Preservision, I believe. But you can easily look up the AREDS 2 formula and then look for those ingredients in the bottle. It's really, really widely available because it is the formula that is evidence-based. And so, yeah, I just really want to emphasize that one capsule that has solid evidence for having a significant effect on decreasing macular degeneration is not without value.
What's the problem with zinc, of having too much zinc?
Zinc is, so you can get into zinc toxicity. I'm just going to actually pull up here. 1 second. Give you an answer from my recent research. Okay. So excess zinc can cause impaired immune system function, anemia, copper deficiency, a change in taste, and nausea and vomiting. So copper is essential for quite a few chemical processes in our body. And if the zinc is in excess, it impairs the copper function and we start to get into trouble with everything working well. It's kind of ironic because all the things zinc does for us, it stops doing for us if we have too much.
Okay.
And just to kind of touch on zinc testing is something that is, oops, and I just so I'm looking at my handout here. I did hours and hours and hours of research recently to come to this specific answer. Zinc testing is accurate if you are in a very high state or a very low state, and not particularly helpful if you're in the middle. So it's a test that can be worthwhile running if you want to see if oh my gosh, is my zinc out of control, but it's not great for the middle range.
Okay, thank you.
Feel free to fire any other questions my way. Zinc is something I struggle with, and that's part of the reason that I have this complicated handout I'm looking at right now. In fact, if you guys would like, I can actually send you this handout so you can look at this information if you'd like to. Okay. Zinc is funny because almost everybody that I see is most likely deficient in zinc. But with these nutrients that are dangerous in too high quantities, I have to figure out how to tread that line to serve my patients well and make sure they have proper nutrients. But I don't ever, I often tell my patients, my goal is to make sure that I never look back and regret anything I've done. And so I don't want to inadvertently recommend something that causes a toxic level. We're going to talk about this again in a second with a few other nutrients. So yes, I will send you that handout. If I forget, please remind me. It's research heavy, but that's okay. You can look at the summaries if you want to. You can look at the research if you want to. I found it quite interesting. I had given, just as an aside, I'd given myself the challenge of looking at the current research in terms of the value of testing for nutrients, because it's a common misconception. People will come and see me and say, I just want to test to see what all my vitamin and mineral levels are, and then we can figure out what to supplement. And so I wanted to have a very current research informed answer about which of those tests are valid and which of them aren't, because it isn't, oh my gosh, it would be so much easier if I could just send you to the lab and then it would come back and it'd be like, okay, you need B6 and C and E and we're good to go. It's not quite that clear. So that's how I ended up doing that. I'll stop talking about zinc now, I think. Okay, don't be afraid to send more questions my way, but I'll keep
Danielle,
them. Yeah,
Danielle, I have a question.
yes.
I have a question, Diane. I get terrible diarrhea when I take the ones that you have listed there. Are there different companies that have different levels of lutein and vitamin E and so on that maybe I should try where I don't get the diarrhea?
So if you're going to navigate it on your own, I would recommend trying a different company's version of the AREDS formula. And then beyond that, I would recommend talking to a healthcare practitioner like a naturopathic doctor and putting together the ideal formula for you and figuring out what's happening there. So potentially the one you're taking has an extra ingredient in it that's actually the cause of your symptoms. And so you can rule that out by trying a different company's version. But then beyond that, I think you'd be wanting to look at getting some help with finding the right formula for you. Does that make sense?
Would your pharmacist know?
Yeah, so you could definitely go to your pharmacist and say,
Would you-
find me a different bottle that has the AREDS 2 formula in it, and they will easily and happily be able to do that for you.
Okay, thank you.
No worries.
Okay, Dielle, there's a question in chat. Maybe this is, do you know biologically why tears are a response to high emotion? In other words, why do we shed tears?
So I was doing some interesting reading. I decided not to put it in the talk today, but I'll touch on it briefly. We've connected tears to prolactin levels. So prolactin is a hormone that we most closely associate with breastfeeding and the letdown of milk, but it's also involved in hormone balance, and it tends to be higher in women. And so this is an interesting correlation in terms of women crying more easily and potentially their prolactin levels. There is also speculation that the process of crying actually allows us to get rid of some of the neurotransmitters that are involved with the negative emotions. It's certainly true that any way we can get rid of something helps us to detoxify. So sweat and menstrual blood and breast milk and all of the things, dead skin, everything that we get rid of can help us to detoxify and get rid of toxins. I'm not convinced tears are so simple and aseptic and quickly produced. I don't think they're actually a route for detoxification, but I do think that the neurotransmitter levels are related, and the mechanism of crying is calming to the nervous system. But the prolactin levels seem to be quite closely related, and I just thought that was absolutely fascinating. Yeah.
That's interesting because to me that says sometimes you hear yourself intuitively saying, I need a good cry. You know, I need to have a good cry.
Yeah.
And there's that relief after.
I don't know about you, but there's a particular scene of Grey's Anatomy that I have gone back to every once in a while over the years when I needed a good cry. You guys, someone might know what scene I'm talking about. And I needed a good cry, so I just sat and watched it until I could get the tears going. It felt better afterwards. Okay. Get my slides going here again. Okay. We did that already. Oh, good. So we're on the last one and we have just enough time. Do we have, 4 minutes? Are we done? Yeah, okay. So supplements, for sure. The best supplements to choose from that have very little risk of side effects is the food-based supplements, the berry-based supplements. I keep bilberry on my shelves as a matter of course, because bilberry is wonderful for protecting the sensitive tissues of the body, the small veins and vessels in the eyes. Lutein, astaxanthin, and zeaxanthin are things you'll frequently see in that antioxidant combo. And lutein has the best evidence of all. In terms of getting these things from food, your leafy greens, particularly kale, the lutein content of kale is disturbingly high. And a reminder that for the most part, it is actually ideal to cook the kale. And I looked this up ahead of time to ensure that this was accurate information in regards to the lutein content, and it is. So I've talked before about the fact that we are overly focused on eating raw fruits and vegetables, when in fact cooking them can liberate some of the antioxidants, and this is true for lutein. So it is higher in the cooked kale than the raw kale. Still spooky high in the raw kale, but don't be afraid to cook it. And red and purple berries in particular, though as I sit here right now, I can't think of a berry that isn't like in the red purple realm, but anyway, with a little bit of fat. We have evidence now that a little bit of fat helps you to absorb these things. So you may have run across that in terms of recommendations for having a little bit of fat in your smoothies, because it helps to balance it out, make it absorbable, and make it more satisfying.
Would that be like some nuts?
Nuts, olive oil, avocado, coconut oil. Yeah,
Okay,
exactly.
good.
We talked about beta carotene being the food form, like it's the initial form of vitamin A, and then it gets converted into retinol. And so I've got vitamin D, vitamin A, vitamin E, and vitamin K2 together there. They're all fat soluble vitamins. They're all helpful for the eyes. They're all toxic in too high quantities. One of the interesting things is we're starting to get evidence for each of them keeping the other in balance. So if you take vitamin A with vitamin D and you take too much vitamin D, that vitamin A can help blunt that effect. So they all work together. And vitamin K2, we should make it a topic to just talk about K2 in a future conversation, because vitamin K2 is new and fascinating. But it is part of that formula. So there's one company right now that I buy from separately that has a combination of D, A, and K2 in one supplement. I think it's the way of the future. I've been saying this for a while. I'm waiting for the supplement companies to catch up, but you're going to start to see this a little bit more, formulas that have all the fat soluble vitamins. So please, please, please be very careful if you are thinking of doing this on your own. Omega-3 fatty acids, vitamin C. Vitamin C is highly underrated as a supplement and an antioxidant, highly underrated. And the short thing to convey here is that outside of an acute situation, like if you are actively fighting a virus, you are not going to absorb high dose vitamin D in a normal form. So don't feel like you need to go and get 1,000 milligram capsules to take as a matter of course. And zinc and selenium. So we definitely talked about zinc. Selenium is also a nutrient that tends to be potentially lower and is super beneficial. So
How
really,
much, I'm sorry, how much is too much vitamin D per day?
oh boy.
I'm taking 3,000 milligrams.
So with my patients, I do recommend a test at some point to see where you're falling on the spectrum.
Okay.
The general recommendation was recently raised, and forgive me, I'm drawing a blank right now on whether it was Canada or Ontario. I believe it was Ontario. The general recommendation was raised from 1,000 to 2,500 IU a day. This is the international units, excuse me.
Yes, I'm sorry, I meant to say international units, yes.
This is the dosage above which it's considered a prescription. So in Ontario, I had to do a whole extra set of training to have prescribing rights and to have the ability to recommend anything above that. I don't like to go above that without having a test, because vitamin D is toxic in too high quantities. And I regularly have patients come in who have been mega dosing on things. We run a test and their vitamin D I'm uncomfortable with how high it is.
Okay.
So my recommendation is to stay below that level until you've had a test. That's the safest thing to do.
And that level would be 2,500 international units as a maximum. Okay.
Yeah.
Thank you.
Vitamin D testing is not covered by OHIP outside of particular conditions like osteoporosis. I do see it being run more frequently, but you can also run it with your naturopathic doctor and see what's happening. With a lot of patients, I mean, I've been testing it regularly for years. With a lot of patients at this point, we just need to do one, and I'm comfortable going off that because I do regularly see people who are really low, like so low, I don't understand how their bones are still in good shape, or regularly high. But if we run a test and you're, you know, just on the low end of normal, then I know what to do with that without having to have you pay for a retest. But I don't like going in blind. Some people need a lot, but I don't like to assume that. Yeah. Oh, Harriet, you're muted.
Yeah, we're at the end of our hour, and I got to tell you, you never disappoint. You do such great research, and we are the beneficiaries, and greatly appreciated, Dielle. And you know, I just want to remind everyone, you're not here to give anybody a prescription. If they need to see a naturopath to find out where things are really at with your body, that's where you go. Right?
Yes, thank you. That's always my concern. Don't go buy all the things in high dose.
Don't do that. That's right. Yeah. And the other thing is, I hope best to your husband, and I hope he's okay. Concussions are a serious thing. So
thank you very much. And thanks for bearing with me if I was inarticulate at times.
you were not inarticulate at all. And thank you so much, as usual. We'll see you in, oh no, this is it for the winter session. So Dielle, thank you so much. It's a real pleasure to have you as a resource.
My pleasure. And let's keep K2 on the agenda because it's interesting.